So when I say medicine, the word of medicine, what comes up to your mind immediately? Yes? Oh, needles. Okay, very good.
Like either injections or like Panadol in Europe.
Very good, very good. So that's a good point. So have you ever wondered why sometimes you take pills, but sometimes you have to get injections? What's the difference?
Some things might be more severe.
More severe, but why severe you take injections, but not severe you take pills? Yes?
Because like if it's serious you need it to like go into your body quicker and like
Yeah. Which one's quicker?
the injection.
Very good, yeah.
Yeah, I was gonna say like because it's going straight into your blood, like it can flow quicker and it probably works a bit better as well.
Yeah, that's a very good point. But then there's also other things. So you both have really, really good answers. So the selection of the type of medicine depends on two things. The first thing is the size of the molecule. So imagine for Panadol, the molecule is like a pea, but that small. But for vaccination, so you get a flu shot. Yeah, I guess imagine you have done that. Yeah, you haven't done flu shot? Yeah, I know, no one likes it. But why we don't like it, we still have to do it? Because the vaccine is like a tennis ball. It's much bigger, so it can't get absorbed by your guts. So small molecule goes to your stomach and get absorbed to the guts, and then transferred from the gut membrane into your bloodstream. So it's small, it can transfer. But if it's a tennis ball, it's too big. It can't transfer from the gut membrane into your bloodstream, so I have to get it in. So then also there's differences, right? If it's a flu vaccine, you might have seen that the syringe is like this big, right? It's small. So in this case, you do it here on the upper arm. But why here, not other areas?
I actually don't know.
That's okay. Yeah. Just say what you think. Why is that?
Because then it can, rather than like place it to the heart.
Close the heart and then go to here.
I don't know.
Yeah. Okay. So for the vaccine to become effective, it needs to get injected into muscles. So here you have lots of muscles, and also it's easier for you to expose this area to the nurse. If you want to get injected into your leg muscle, you have to take off your pants. That's not good in a public area. So that's the most convenient way. However, this is for flu vaccine. You only have this amount, like sometimes 1 ml, sometimes less than 1 ml. But sometimes you might need to get injected with this amount of volume. This, you can see there's a huge difference. So if you need to take this amount of drug, you can't do it here. There's not enough muscle for you to inject. You can't do it here. That's too painful. So then what do? You inject here. There are more muscles here, and it's softer, less nerves, and less painful. But the downside of this is that it's more slowly. It's not as fast as here. So depends. If you want it to be effective very quickly, you need to do it here. Then this is yes.
Like could they even do like they couldn't even do like half on one side, half on the other? Or is it just more effective in the butt?
Well, if you do it here and here, it's the same thing. So we might just do it one side.
Or drip?
Drip, yeah. So yeah. So this is bigger volume. It's about this size, right? But sometimes you need to get even more drugs in because the patient is really ill. Then you do the drip in the bag. This bag is 100 ml. It's a double size of this syringe. But the downside is this one you need to go to hospital.
Yeah, you got to stay in hospital for like a few days.
Maybe not a few days, depends on how much you need to get injected. But it's definitely longer than the syringe. Syringe is like a few minutes. This one might take an hour. And you can't get injected very, very quickly. It's very bad for you because you get things in. Yes, in the vein. Yes.
For like the big syringe, can't you put like a really stronger one in the small syringe so you don't have to use so much?
Oh my god, that's such a brilliant question. So, you know what? This is all we want for, and this is my job. So, I try to turn something this size into this size. I want it to be more concentrated, so you don't have to get injected so much. And also, I want to give you a tip. When next time if you have to get injection, how do they make you feel less painful? Simply, you ask the nurse to do it slowly. So if the nurse, because they want to finish their task quickly, they might do this, and it will be very painful. But for the same amount of volume, same amount of drag, if you want to feel less painful, you ask them to do very, 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 very slowly. Then you don't feel painful as much. So next time, go to tell the nurse. Don't do it too quickly on me, I feel painful. So overall, I'm a formulation scientist, so my job is to turn the drug or change the drug that's currently in this kind of format into a syringe format. So you can do it at home by yourself, and it's less volume to inject. And if possible, I try to turn the drug in this format into a pill. So there's no pain. It's very, very easily to get injected, digested. But it's very challenging because we know that you can't absorb a tennis ball. So sometimes it's just a limitation of the molecule itself. I can't turn it into a pill, but I can definitely try to turn from this one to this one. And that's my job. So if you're interested in doing something like me, you can study medicine or study pharmaceutical science or study biomedical engineering. They're all leading to this career. So I hope this give you some insider information of what I do. Yeah.